times get hard, and we're here to help at NorthPoint.
Hello, and welcome to another episode of NorthPoint, Making Health Happen. My name is Lisa Castillo, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. And we want to provide you with practical tips and resources you can use. Today, we will be discussing men's health, and joining us in the studio today is Dr. Kevin Gilliam, who is the medical director here at NorthPoint. I'm just going to share a little bit about you, Dr. Gilliam,
Okay.
but welcome.
Thank you. Glad to be here.
Kevin L. Gilliam II, MD, received his Bachelor of Science from Tennessee State University in 2002, his medical doctorate from the University of Cincinnati in 2006, and completed a residency in family medicine at Emory University in 2009. He is a diplomat of the American Academy of Family Physicians and the Minnesota Academy of Family Physicians, as well as the American Board of Obesity Medicine. He is the medical director here at NorthPoint Health and Wellness Center, where he also functions as a primary care physician. He has been recognized as a medical rising star and a top doctor in the Minneapolis-St. Paul magazine. He has completed a master's degree at Luther Seminary with a focus on justice and reconciliation. He is married with a school-age child and enjoys biking and generally being outdoors. He's been involved in the development of our annual Fit for Fun event and has been co-captain of NorthPoint cycling teams. Dr. Gilliam, thank you for being here today.
Thank you for having me.
So excited to have you. Yeah, so we're going to be talking about men's health, which is a very important topic.
It is.
Our focus really is, for this conversation, is about early detection and preventative health care, right? Because we know that those two things can shift the narrative for crisis management to proactive wellness.
Right.
Empowering Black and brown men to take control of their health and reduce the cycle of preventable illness passed down through generations. So that's what we're here to talk about today. And I'll start by asking you, what are some of the most common chronic diseases affecting Black and brown men in our communities, and what can be done to prioritize prevention?
Yeah. Again, thank you for inviting me and having me on today. I think the more common chronic diseases we see in the community aren't just in the Black community or kind of affecting Black and brown men, but where we see men, or these men in particular, kind of more greatly impacted than others. We think about weight and kind of obesity, so that has a significantly higher prevalence in the Black community broadly, and in Black men specifically as well. And then as we think about things that carrying more weight on our bodies can impact, so we think about high blood pressure, so hypertension is quite prevalent and has a higher incidence in Black men as well. And then we also think about diabetes, which is kind of the management of blood sugars, which can be impacted by carrying more weight on our bodies. And then we think about heart disease. And then as we think about heart disease, we think kind of broadly about cardiovascular disease. So kind of heart failure, stroke, and then kind of hypertension, high blood pressure falls in there as well, because it's a risk factor for that. And then we also think about kidney disease, which if we have a higher incidence of high blood pressure, hypertension, diabetes, that places us at greater risk for developing chronic kidney disease as well. And then what we all are concerned about, cancer incidence. So as we have kind of higher incidence of these other chronic diseases, we then do also have a higher incidence of prostate cancer, and what men tend to think of specific to them, because the other cancers are kind of cross genders.
Yes.
So both men and women can experience kind of lung, colon, and other kind of cancers like that.
Yeah, you brought up the prostate cancer. I'll lead with that because that's very personal. That hit home at our house too. So I want to talk a little bit about early detection and how, I think there's this stigma or this belief in our culture that if you're someone who is diagnosed with diabetes or high blood pressure, some of those things that they can't be managed, that it's kind of like the end of everything. So I want to talk about dispelling that a little bit and how early detection and preventative health care can offset that.
Yeah. I think I talk a lot about in community as well as in rooms and with the other kind of doctors and clinicians in our system and others about not just doing the work that happens in the room when someone comes in and their blood sugars are higher than they should be or their blood pressure is higher than it should be. But thinking about how do we take a few steps back, zoom out a bit, and get a picture and an idea of kind of why these things are occurring, and then continuing to ask the why. So as we zoom further out, and I love the parable of the stream, and where you kind of go upstream to see kind of why kind of all these issues are coming downstream. And so as we get further and further upstream and kind of look at systemic things that may have occurred, whether it be access to food or access to housing or community infrastructure, kind of all these things that impact our health and well-being, that when we're sitting in doctor's office and we've been told that our blood pressure is higher than it should be, or our sugar is higher than it should be, or I've been diagnosed with prostate cancer, these things I'm not thinking about in that moment because I need to deal with them. But for the next man or the one that has yet to make that appointment, how do we do things or implement things that will get that person into the office sooner? Or do things in community, engaging with our partners that kind of do this work in the community, whether it be in the legislature or in other facilities, that educate men about why they should engage more in the system and what they should be asking about, so that they can be good advocates for themselves, their health, and also engaging with the people who support these men. Many times men do not access care as often as women, because there may not be what they feel is a need to go in. Many times when we're kind of younger ages and in kind of childbearing age ranges, there are reasons for women to present to a doctor or a clinician. And as you mentioned, there's a sense often if it's not broken,
why fix it?
So no reason to really to go in. But
sure.
As I often relay, kicking the tires on your car, kind of getting the oil changed every 5,000 or 7,000 miles is a good idea for maintenance. And so the same can be said for us as humans. So kind of checking in to make sure you're kind of maintaining.
Absolutely. Well, and one of those factors, do you think we have a historical mistrust in the healthcare system, right? And cultural stigma. I think that prevents sometimes men from coming forward to check on their health. Do you see that with your patients? Can you talk about that a little bit?
Yeah, I mean, I think many black men present to me as a black man and kind of relay some of those concerns with the kind of the medical system broadly. And I can say they don't experience that necessarily with me, at least from my vantage point, but it has been shared with me that, and I have seen that kind of in personal life and interactions where whether it be someone in my family or a friend would ask me questions because they didn't necessarily trust what was relayed to them. And oftentimes it's essentially me saying the exact same thing the other person said. But since I'm a trusted confidant in that moment, whether it be a family member or a friend, they receive it differently. Similarly, when I ask my daughter something, and she didn't hear it, right? But someone else says it. It just sounds different. Yes. But that mistrust in the community is wrapped up or tied to rather kind of lots of history. Yes. And whether we've experienced it personally ourselves, it is known in the community that it is something that happens. And whether you can point it out or not, I think that is the insidiousness of racism that is kind of baked in to a system that can result in a health disparity. And it's not necessarily because the clinician that you're meeting with is purposely doing a thing, but if it leads to you not asking another question or remaining quiet in a moment and not revealing or not coming in, then that leads to those gaps we talk about, those disparities we talk about. And then oftentimes while those risks then kind of balloon and are exacerbated because we waited until it couldn't be bared any longer, or until the person that is close to us has pushed us to go in. And then we find out
there's some stuff going on.
Things going on, right?
Yeah. Let's talk about culturally what am I trying to say? Culturally competent care and how that plays a role.
Being competent in a person's culture, and knowing that just because a person is from a particular racial demographic doesn't necessarily mean that culturally they're all the same. So having some understanding of culture and what that means kind of leads you to asking more engaging questions in just improving communication skills. And culturally, there may be certain words or phrases that I may use that if you're not a part of my particular culture, you may not understand. I grew up on the East Coast in Maryland, DC area, so there are certain cultural nuances of the language that we may use when I was growing up that were different than where I trained in Georgia. So kind of understanding cultural differences, although similar, not the same. So engaging and asking questions. Say, what does that mean? It helps it shows interest. It builds trust. You engage with the person. And, so in asking, so why this? And, what types of things do you guys tend to eat at, for dinner or at different celebrations? I celebrated Thanksgiving when I was in college with a friend of mine who was from New Orleans. And they would have gumbo as like the starter. And that wasn't a part of my family tradition. It's a tradition that I was appreciative of. Yes. Because the gumbo was fantastic. But, like those little nuances. And then you bring those things back in the conversation. And so, because it's the primary care relationship is that it is a relationship, and it's not just business,
Right.
So it's, I got 20 minutes. We need to kind of click through this
Yeah,
checklist of things.
absolutely.
People often are sharing very intimate and personal things about themselves, things that have hurt or harmed them, and so they need to know that the person that they're engaging with, they can trust with this information. And when there's some level of cultural competency, it helps to kind of bridge that gulf sooner. And there may always be a little bit of a gulf, and no matter if we are from the same place and are the same culture, there still may be some things that I will never learn about a person, but it helps me to get closer, so that I've been at NorthPoint now for just over 15 years. And so there are people that I have been seeing for 15, almost 16 years.
Wow.
So when I see a person that comes in and say, hey, how are you doing? And they say, fine. I say, but you don't look like you're feeling fine. Something's different. It's a part of that relationship.
Yeah.
And so I have, through the years, kind of picked up on their own personal nuances, and understanding kind of the culture within which they live, because there are societal cultures, there are community cultures, there are cultures within families, there are cultures within households, and so there are layers to kind of cultures when we think about it. And my two neighbors have a different culture than I do, but the neighborhood culture may be, similar.
Sure.
Yeah.
Okay. So to someone listening, because we really want to make this relevant, right? So to someone who has a loved one who may not get those wellness checks or may be a little unsure, what would you say to those folks?
Yeah. I think the best example of encouragement is being an example. So actually engaging in kind of regular checkups, healthcare yourself, engaging in kind of healthy eating practices and healthy movement and physical activity practices, and kind of engaging with kind of mental health care if it's necessary. And then inviting and encouraging and reminding the men that you love that they also need to do those things.
Yes.
And you'd be more than happy to kind of help them arrange or kind of get to these things, because the ultimate goal of it all is so that we can live life longer and that life be worth living as we get kind of advanced in our age. Because as we are older, we actually want to be able to engage with those we love, be engaged in community, and not be suffering in our older age. And the way we do that is to engage in kind of regular care, these healthy practices that we know and that are proven to kind of help us to prevent these chronic diseases that we talk about. And even if you do develop a chronic disease, so your genetics or your family history is such that you're not going to be able to dodge high blood pressure, or your sugar might be a little or your sugar might be a little elevated. It how elevated it will be can be impacted by those healthy practices that you do. So if you've engaged through a lifetime in healthy eating, healthy physical activity, if you do end up with elevated blood pressure, you may need, if you need medication, you may need one as opposed to 3 or 4 or 5. If your blood sugar is a bit elevated, you may just need to avoid sugary things as opposed to avoiding sugary things and needing medication. So there are kind of levels to which if you kind of walk in to a condition that you end up living with as healthy as one can be, that impacts the kind of the path you take.
Sure.
And it's not to say that you cannot adjust. So if you say, you know, my teens, my childhood, my 20s and 30s and 40s, whatever age you might be now, I was not thinking about these things.
Right.
That does not mean it's too late to adjust, because many of these things can be reversed, and or we can lessen the impact of it on your life.
Sure. And we have tools here at NorthPoint to aid in that. We have dietitians, we have nutritionists, we have educational resources and those sorts of things. Can you talk a little bit about that? What we as NorthPoint do to promote that?
Yeah. You know, we as I mentioned before, we're kind of a primary care center. So it's not just the clinicians, so the doctors and nurse practitioners who kind of provide care and management of those, but we also have lots of support around that. As you mentioned, we have dietitians, we have a health coach, we have clinical pharmacists, and so our dietitians will kind of dig in with you in the details of your diet. So looking at, you know, your protein intake, your fat intake, your carbohydrate intake, your goals, and all those kind of things. The health coach will work with you and see kind of where you are in terms of your readiness to make some changes and some shifts in your life. Because not all the time do people walk into the office fully prepared for the news that they're receiving. And so it can be a shock to learn that you have high blood pressure or that you have high blood sugar, and now you need these medications. You need to start checking this and that, and you're needing to see us more often. And so that can be a bit jarring to a person. You know, so we help people to kind of navigate that change a bit and kind of to help orient people for success. We have clinical pharmacists, so if we do need the provision of medication to help people to manage these conditions, they help us in adjusting doses and, you know, making sure that we're not sensing or having any side effects related to medication, and make sure things are well coordinated there. We have group visits, so if the one-on-one visit you need a little more education, we invite people to group settings to engage in community, because we know that being in community is also a part of the healing process. We have diabetes educators for those who have sugar concerns. And so we have lots of supports for people. And if food access is an issue as well, we additionally engage kind of with our food shelf to help people to have enough resource, and then kind of navigating around the access that people have. To the whatever resource that might be, and then helping them to use those resources in a way that's healing, and will kind of provide them with greater wellness than they might have had previously.
Okay, before I let you go, I do want to talk about prostate cancer for a second, because I know that is high on the list. Can you talk a little bit about how prostate cancer, how it occurs, and what are some signs? What should you be looking for? Any kind of detection?
Yeah. You know, I think even before people get to the place of that, I think it's always good to talk within your family with people about their conditions. We often don't share with one another what we're dealing with.
So you're talking about family history right now?
Family history, correct.
Okay. Yeah.
So if my father was diagnosed with prostate cancer at kind of whatever age, and then his brother and his father, then I know that I'm at greater risk,
Sure.
and I need to inform my clinician about that. And if there is no family history in my family, so we screen earlier for prostate cancer if there is a family history of early diagnosis. And so if my father, so we're talking about direct relatives, my father is diagnosed at 45, then I'm going to start getting screened 10 years earlier.
Okay. At 35.
At 35. And there are not always symptoms
Yeah.
of prostate cancer. We often will kind of start asking more questions around the prostate if men are having symptoms with kind of urination and where it changes it away. What I often will encourage people is that if anything changes, so you've been living on the planet for 30, 40, 50 years, and for all those years, when you go to the restroom, you urinate, it's happened one way. And then all of a sudden, it starts happening another way. Come on in.
That's a change.
That's a
That's a
change.
sign.
That's a sign something's different. Come on in. We'll check that out to make sure that there isn't anything happening that we should be worried or concerned about. The screening test we tend to do is a blood test. It's the prostate specific antigen, or PSA. Generally, we tend to screen at the age of 45, Black men specifically. There is some debate, and this is shared decision making around whether one should screen for prostate cancer, given the incidence is what it is in the Black community with Black men. We always have the conversation with Black men surrounding family history, and then what would happen if the PSA or prostate specific antigen is high, because that would lead to a biopsy of the prostate,
Sure.
and then other potential interventions. Most men do opt for the screening just after a conversation, because we don't do any testing on a person without their consent, but we do ask and screen all men for prostate cancer starting at 45, unless they've revealed a family history.
And then you start
Then
sooner.
we start sooner.
Okay, great. Well, thank you so much. There's, we could go into
Yeah.
a lot more. We only have a limited amount of time with you today, but we appreciate you being here on the program.
Thank you.
Yes.
I enjoyed the conversation.
Yes, it was enlightening.
Good.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard.